Hi, ladies. Welcome back to the show. I'm Roxann Klepper, and this is Brick by Brick. While saying I'm excited for today's guest would be an understatement. Today's guest is Dr. Esnielle Brooks. She's a dedicated family physician and passionate advocate for women's health. She is the founder of the Menopause Clinic here in Red Deer, Alberta, as well as the Global Menopause Network, which is an organization in its baby steps still, focusing on education for patients as well as healthcare providers. She graduated with her Bachelor of Medicine and Bachelor of Surgery degree in South Africa in 2007 and obtained her CCFP certification, becoming a Menopause Society Certified Practitioner in 2021. Passionate about women's health, Dr. Brooks has further enhanced her expertise by completing specialized courses in menopause through esteemed institutions including the SOGC, IMS, and the Mayo Clinic. Dr. Brooks is happy to provide consultations on both hormonal and non-hormonal management of menopause, as well as advice on different conditions and symptoms, basically all women's health issues from contraception to vaginal conditions and perimenopause and menopause management. She's an active member of several professional organizations, including the Canadian Menopause Society, International Menopause Society, the Menopause Society, and SOGC. Dr. Brooks is committed to providing compassionate care and empowering women to navigate their menopause journey with confidence. Dr. Brooks, thanks so much for being on the show today.
Thank you for having me, Roxanne.
So, I gave the audience a little bit of background for you already, sort of some academic background, but I thought we could start off today by just giving the audience a little bit of history on you and kind of what spurred you to become so passionate about women's health and particularly women's hormones.
Hi. So I have a little bit of a journey myself. Um, I over the years have struggled by myself with hormonal issues and infertility, and so that was sort of my own little journey and going through treatments and IVF and so forth. So I've had my own struggles as far as hormones and women's health goes. And I just felt inadequate in treating my patients. I was like, I've my with my journey and my experience, and then seeing how my patients felt, I had a lot more empathy and understanding the process, and I just felt that I didn't know enough, and it's not just with younger women and fertility and PCOS and those sorts of things, but more so in I found my older patients, my perimenopausal women and menopausal women who came in complaining of brain fog and significant mood changes and hot flashes and night sweats, and I didn't feel like I knew enough. I had to go and look on Up to Date and things like that on what to treat women with, because we don't get any training in med school. Like I cannot recall having any training on menopause. Nevertheless, even I don't think we even had a question in our exams on menopause. It just wasn't dealt with. So it's one of those gray areas where I never felt comfortable treating a patient, and I always felt like I had to go look up
Oh,
how to manage my patients because I just didn't feel comfortable. And so that spurred me on to start learning more about women's hormones and and more into women's health. I've always had a passion for women's health and delivering babies and that sort of thing, but not as much into the hormones as I did there.
okay. Very interesting. And I think there's just a common theme there, and it's just menopause and how no one talks about it. I remember growing up, no one's moms ever talked about menopause, hot flashes, their hormones. You just kind of dealt with it on your own. And so, going forward, it's nice to see people actually talking about it and asking questions instead of
Yes.
just suffering on their own.
Yes.
Yeah.
Absolutely.
And
Absolutely. I think there's more of a movement
yes.
to get people talking about it now.
Yeah, agreed. And so I was out for lunch with a friend the other day, and we were talking about some issues we were having, and hormones came up, and I thought, I wonder how big a percentage of women who are having different issues that we just chalk up to stress or we're busy or we're whatever, but that hormones are really at the root of a lot of those problems.
Absolutely. I think a lot of us blame it on stress or just life, and don't always realize that these things are not within our control. I especially I feel like the cognitive changes we sometimes see in perimenopause is a lot of women think, "Oh, I'm just stressed or I didn't sleep well and that's why I'm feeling forgetful today."
Right. And so you brought up the word that I was the most interested in asking you some questions about, and that's perimenopause. And I feel like until, I don't know, like 18 months ago, I had never heard of it before. It was always just menopause. And so what is it? Where did it come from? And how come we've never heard about it till now?
So perimenopause is actually it's a phase of menopause. So when we look at the menopausal transition, perimenopause is those years that leads up to menopause. So perimenopause is basically any time for where your periods start to become irregular and you start to notice all these symptoms up until 1 year after your last period, which is then when we classify you as menopausal. So up until you haven't had a period for a year, you're considered to be perimenopausal, and then menopause is that one day where it's been a year since your last cycle. And then anything after that is postmenopause.
And so what are the difference in symptoms between perimenopause and menopause?
So, the main difference is with perimenopause, you get irregular bleeding and irregular cycles, whereas when you're menopausal, you don't have a cycle anymore. But otherwise, apart from that, the symptoms are pretty much the same. I find women sometimes present with their symptoms more severely over the perimenopause phase because of that extreme fluctuations in hormones. So you get these upswings in estrogen and progesterone and down and up and down, and that's where these extreme mood swings and hot flashes and cognitive changes come from. Whereas when you're menopausal, you have your hormones sort of go away and the symptoms start to eventually get a little bit better.
Okay, so when you hear women say they got it's the hot flashes and the mood swings and all those different things, it's probably perimenopause and not menopause.
It's very likely. It depends. Like I said, I think it depends more on cycle. If they haven't had a cycle for a year and they're having these symptoms, they're menopausal. But if it really the cycle is the only thing that sort of distinguishes more perimenopause versus menopause.
Okay. And so when does perimenopause typically start, like age-wise? It's
Gosh.
probably so
So
different for everyone.
yes, and
Yeah.
it depends on really on your age of menopause. So some women can go into menopause as early as 45, and perimenopause can start 7 to 10 years before menopause. So you can start having perimenopausal symptoms as young as 35.
Oh
I've
my
seen quite a
goodness.
few patients in my practice that are late 30s with classic perimenopausal symptoms.
And so do you find in your practice that people are maybe having these symptoms earlier and earlier as time goes on?
I don't think so, not necessarily. I think it's just not been recognized as perimenopause for most of what I can recall. If I now look back at practice over the years, I can say I probably missed quite a few perimenopausal women in their late 30s because we just weren't aware and I just wasn't
Right.
trained well enough.
Right. I find that very interesting that it's maybe not a big medical part, like you said, of your training, but it's such a huge part of a woman's life. I think it's amazing now what you're doing. And so maybe you can tell us. I heard that you had a menopause seminar a little while ago, which is what spurred me to have you on the show. And so maybe you can get into a little bit about your seminar and what you talk about and kind of how it can help women ease into either the perimenopause or the menopause.
One thing is I love treating women in menopause and perimenopause, but my biggest passion is educating women on their bodies, on their hormones, on their health. And that's where this passion has come along for me to create these seminars, to create awareness and education for women to learn about what is normal, what do we expect, how do we manage this. So in November I did one a few years ago with Nicole Schmidt at Al Physio, and at that point we did a evening with just questions and answers. And I had Jen Pilon from Aspire Medicine that was with me on that one as well. And we talked about natural remedies and pelvic floor health in menopause. And so that one sort of fueled my fire a little bit. And then in November of this year was the first big day I did at Heritage Ranch. And we did a full day. It was a jam-packed day from early morning to late afternoon. And we talked a lot. I did a few talks about what is menopause. Let's We talked about pelvic health and vaginal symptoms and sexual health post menopause. I had guests. Tara Fitch was she's a clinical social worker. She did a bit on cognitive health, um, brain fog and mood swings in menopause. And Jen Pilon again with her naturopathic side and foods and how to tackle weight gain in menopause. And then we had Kelsey Moreau from Al Physio, which is she's an amazing pelvic floor physiotherapist that deals a lot with women and prolapse and things like that, and how to manage osteoporosis and prevent osteoporosis. So a jam-packed day. Like we really tried to fit in pretty much every aspect of menopause, which can be overwhelming for a lot of women. But I really just I want to get that out there is just answering those questions. I feel like there's so many questions and there's so much misinformation on the internet.
For sure.
And so that was the most recent one I did.
It sounds fabulous and super in depth. And I agree. I do think there's so much misinformation. You could go online and find 40 different answers for your question, but how do you know which one's right?
Yes,
That
absolutely.
sounds amazing. And so many broad topics. Like you said, food. Like I think people never think about the foods that you eat and how it affects your hormones and how you feel and all of those different things.
Yes. Yeah,
Very
and
interesting.
especially that weight gain we see in menopause. I
Mm,
feel like that's probably one of the biggest things or biggest complaints that women come in with too, is that menopausal belly weight gain that we see. And so just strategies to try and manage that.
right. And so now I have a question, and this question is solely about me. But menopause, perimenopause, and alcohol. Is there some weird? So I find that even if I have one glass of wine at night, I will wake up with night sweats, hot flashes. I don't sleep at all. I wake up at 3 in the morning, wide awake, anxiety. Is alcohol, does it have some sort of link to menopause and perimenopause? Like I just don't, that never used to happen before. And now I find it happens all the time. And I talk to
Alcohol.
lots of other women who have the same issue.
Yeah, alcohol is definitely a trigger
Okay.
for hot flashes, night sweats, palpitations in perimenopause and menopause as well. It's a definite trigger. I think as we age, our liver metabolism changes, but I'm not sure if there's a link between hormonal fluctuations and how our livers metabolize alcohol. But it definitely alcohol, caffeine are both known triggers for hot flashes, night sweats, and
Good to know. Because, you wouldn't think one glass of wine would do that, but all of a sudden you're up in the middle of the night thinking, why am I just sweating buckets?
yeah, I've seen that so often in my practice. As I've had patients who say they have half a glass of wine at nighttime and then they know it.
Okay. Well, thank God it's not just me. Okay, I wanted to ask you some questions about menopause myths. What are like the biggest myths you hear about menopause and how do you address them with your patients?
I feel like probably the biggest myth is more about hormone replacement therapy than menopause as such. I a lot of people and colleagues even still um, are still believing that hormone therapy causes breast cancer, and that is probably the biggest fear that I see in patients who come to see me, is that they're worried they're going to get breast cancer with hormone therapy. Now that has been, and I think that stems back to the 2002 Women's Health Initiative study, where they stopped the study and said too many women got breast cancer, and that's why hormone therapy is not recommended. Now, since, I mean, in 2022, the North American Menopause Society released a new hormone position statement, and that Women's Health Initiative study has been torn apart repeatedly now. And the consensus is that hormone therapy, estrogen alone does not increase risk for breast cancer. When you're doing a combination of estrogen and progesterone, there's a slight increased risk for breast cancer, but it's not a statistically significant increased risk in breast cancer. So the risk with hormone therapy is the same as with smoking is. So if you put it into perspective, someone who smokes has the same risk for breast cancer as someone who uses hormone replacement therapy. And so I still feel like that's one of the biggest myths that I have to deal with in clinic, is that extreme fear of breast cancer when we're talking about hormone replacement therapy. Now, it's not hormone replacement therapy is not for everyone. It's not a one size fits all. You have to really individualize every patient, but I feel like that's probably my biggest challenge and biggest myth that I see, is that still that thought that hormone replacement therapy and is linked to breast cancer.
Okay. And even I've heard it a lot that raised estrogen levels. And so is that true that so your hormone therapy is just to bring your hormones back up to a level where your body would naturally produce them. Is that correct?
Absolutely, and in perimenopause more so to stabilize those fluctuating hormone levels.
Oh, okay. So then throughout your lifetime, if your body maybe does produce too much estrogen over your lifetime, are those people at a higher risk for those specific cancers and different, um, reproductive diseases than other women?
So that's where we really have, there's a list, a big list of risk factors when we're looking at, I usually use a model in the clinic. It's a it's a, we call it the IBIS or the Tyrer-Cuzick model, and with that you put in, there's a few risk factors we look at. We look at the age you had your first baby, the age your first period started. There's a lot of these little things that we use to calculate your breast cancer risk as such. Now, it usually gives us an average risk for your age group, and then it calculates your risk based on your risk factors. Now, I usually do that with my patients in the clinic, is I calculate their personal breast cancer risk score, and then put it into perspective for them and say, this is what your risk is. Hormone therapy is if you don't have a uterus, if you're doing estrogen alone, there's no increased risk for breast cancer. But if you're using estrogen and progesterone because you're still having a uterus, there is a very small risk. But your benefits outweigh your risk. And especially if you're having debilitating hot flashes and night sweats and you're not sleeping and you're having brain fog in the morning because you had to get up 2, 3 times during the night with hot flashes or night sweats, then your benefits of treating that is much more than that slight increased risk that there is for breast cancer.
Okay. And so to treat those symptoms, you need estrogen and progesterone?
If you have a uterus still, if you haven't had a hysterectomy, then we do need to use estrogen and progesterone to protect the inside lining of the uterus. Because if you use estrogen alone, you can develop endometrial cancer. So if you've had a hysterectomy and your uterus is out, we can do estrogen therapy on its own. And so with that, that Women's Health Initiative study actually showed a decreased risk in breast cancer. And so women who've had a hysterectomy, for those women, I always tell them, you really don't have to be scared of hormone therapy. I it really is individual. I mean, obviously, I think there's multiple other things that play a role, like cardiovascular risk and that sort of
Sure.
thing. And I can talk for days on that too. Like, you have to really look at individual patient risks when you're looking at hormone therapy, but it definitely benefits outweigh risk tenfold in patients who are good candidates, definitely. And I feel like majority of women are good candidates for hormone therapy.
Right. Okay. And so that makes sense. It's and like you said, it's so personal. Even everyone's symptoms are probably different, right?
Yes.
Yeah.
Yes.
And so, okay, I know you have a new seminar coming up. So
Mhm.
can you tell us a little bit about that? Because I think it's super interesting.
So the this big one I felt was very overwhelming in the sense that it was a lot to cover in one day. And so I've decided to split them into smaller, more focused seminars and groups. So the next one I have is I was my thought was to have it just in time for Valentine's Day. And so I am holding it at the cooking room. So with at the cooking room, we have this cooking demonstration and hands-on, and I'm encouraging women to bring their husbands with them because I think it's a very important for them to understand not just the physical changes but the emotional changes that women go through in menopause. And so the seminar is titled Passion Beyond Menopause. And so I really want to focus on not just vaginal changes and sexual dysfunction in menopause, but how practical things for husbands to understand as well, that what the physical changes are that their wives are going through, and why it's uncomfortable for them at times, and how to fix that. And not just the physical component, but that's why I have Tara Fitch with me again, is to deal with that emotional and that mental component and reconnection and rekindling the spark and that sort of thing. So this one is going to be like a 2.5 2 hour with a little bit of cooking demonstration, hands on, and then just like discussion about passion and sexuality post menopause and how to manage and navigate that.
I love that. I think half the battle for women in menopause is trying to explain it to their partner,
Yes,
explaining how they're feeling and the different things they're going through and how it really changes your life, everyday life.
absolutely. And I feel like that sexual dysfunction is such a big part of marriages post menopause, and it's probably one of the things that I feel like most women don't want to come and talk about either. I always prompt them and ask them about it in visits, but it's something that, like menopause is hush hush, I feel like sexuality post menopause is even more so.
Agreed. Yeah. Oh, that's so lovely. So you said you're going to break it down into other, are you doing other seminars after that too?
I'm working on those. I have a plan on doing one about menopausal weight gain
Wow.
and strategies for that. So that would be one I'm working on. I'm working on some on doing a allied health professional day as well for physios and chiros, and just trying to bring a little bit of awareness to them as well, because they're seeing women going through menopause and perimenopause with all these musculoskeletal symptoms and frozen shoulders and joint pains and these sorts of things that they're seeing. I'm trying to just bring education out there, bringing to some I'm trying for March to do a day for nurse practitioners and allied health professionals, just to make them comfortable with menopause and how to manage these patients and collaborative care. So I'm trying to build education not just for patients but for allied health professionals, and hopefully for physicians as well in the future.
Oh, I think that's so incredible. Women need it. They need it. They need a trusted source to go to for all these issues that they don't want to share with other people.
Absolutely,
I think
absolutely,
that's fantastic.
and to talk to each other.
Yes, for sure. To know that someone else is kind of going through the same thing.
Yes. I think
Yes.
that's one of my big things with these seminars is I always tell women when they're there is this is creating this community just to
Yes.
know you're not alone. Like all these women that are here today are going through exactly the same thing. And there's so many more out there that are going through it, that you're not alone.
Yes. And I love that you're putting this information out there. So maybe even the women who aren't experiencing those symptoms sort of have the information before it gets there instead of being blindsided like lots of women are.
Yes.
Like providing the education before you're in it. I think that's
Yes.
so fabulous. And so at the end of the show, in the notes, we're going to have links to all of Dr. Brooks's information, her seminars. If you guys want to tune in or want more information, feel free to reach out to her anytime. Obviously, all of us can tell how passionate she is about it. So thanks so much for joining us today. This information was amazing. And I think your seminars are going to be a huge hit.
Awesome. Thank you so much, Roxanne.
Thank you. Have a good day.
You too.